Hi guys, good morning if you are in US and good evening if you are in Philippines. Globally, we can be found in Fishigen PT and Wellness. I'm your host Dr. Jenny Yusuf, physical therapist, Doctor of Physical Therapy, creator and founder of Balance and Fall Support Group in Aging Adults in Facebook group. I'm also the former vice chair of Global Health in Aging Adults in APTA. I'm the state advocate in Delaware here in geriatrics. And also, I'm a certified neurospecialist and health and wealth ambassador. So I just want to connect with you. It's another Thanks God It's Thursday where we highlight innovators, therapists, clinicians. Like they have great technology. Sometimes they educate us. We even have audiologists at some point. But for tonight, we are going to talk about more on AI now in healthcare, the different EMR and the platform. Every year we have great innovations and we always hear AI, right? So let's talk about now some of the EMR. We featured you before, Carlos Garcia Cuesta. He is the Chief Clinical Officer and Vice President of Executive Operations in Optimis PT. It's based in California. It is an amazing EMR, and we'll learn more about what are the new updates of the Optimis PD. So if you're using it right now, connect with us, what you love the most. And if you're not familiar with it, listen to us and connect with us to learn more, all right? So Carlos, welcome again. And Carlos is a physical therapist by background for more than 15 years, and he has a business management. And now this is another epitome of leadership from physical therapy clinician going to business and leadership role. Welcome to Balance and Falls and podcast for us, Carlos.
Thank you, Jenny. I appreciate being back with you and connecting again.
Yes, yes. Tell us more for all the people who didn't watch our previous interview 3 years ago about Optimus PT. What is Optimus PT?
Yeah, so Optimus PT is an electronic medical record software system. It is geared towards rehabilitation specialists, so physical therapy, occupational therapy, speech language pathology. And really, what makes our software unique is it comes with an embedded clinical decision support. What that means is there's clinical guidance for the practitioner as they're documenting in the system and starts giving clinical guidance and recommendations. So the APTA, the American Physical Therapy Association, has clinical practice guidelines that are mapped out based on the evidence of certain body regions. Optimus was part of the leadership that spearheaded the development of the practice patterns, and we are the only EMR that has that embedded in our system. So, as an example, a provider may be evaluating a patient. They're completing their tests and measures, and the system will flag you when you have a likely confirmation of a practice pattern, and then we'll actually give you a color coding confirming that you've met the requisites. And then it gives you clinical guidance on treatment recommendations, goals. So it's not just a SOAP note, software template. It actually gives you recommendations that then feeds into the medical necessity and the plan of care generation for patients. So we're very proud of obviously what that does and how that's really an evidence-based tool as we look to be a practice partner, for the different users that are on our system.
Yeah, clinical practice guidelines is very important, and we're always pushing the evidence-based practice. So that's really good. So we have many CPGs. Is it specific for a setting or let's say orthopedic, neuro, musculature, something like that? We even have cardio and acute care at some point.
Correct, correct. So the practice guidelines, the pioneers behind the practice guidelines are really the orthopedic section
Okay.
of the APTA. That was the first section that established the practice guidelines, and from there the others followed. So in our system, we do have orthopedic practice patterns. We have pelvic health, pediatric, geriatric, neurological. So most of these, and then periodically every 2 years, based on the evidence that's brought out, through the research, we update those practice patterns. So obviously, clinicians then have the latest, evidence and practice patterns that are established by the literature.
That's really good. That's very important. And our challenges as a clinician in an outpatient setting is always documentation, right? So you say something that when they're typing or something, how can it makes it easier? Do you have something like they can talk or and then a script? Because I think you say something about it. Can you emphasize it more?
Correct, correct.
I
So in our
see.
system, obviously, we have the practice templates and the
Yeah.
practice patterns that obviously pulls up to sort of expedite the documentation. It provides it for you. What
Yeah.
we are doing now with artificial intelligence is rolling out our ambient listening or scribing AI technology, which will allow a practitioner, will allow a therapist to, as they talk to the patient and the patient gives responses, that transcription is captured in the system, via a microphone. And then it's transcribed back to the provider and it maps it out to the note. So the subjective will go in the subjective section. The tests and measures will be in the objective section. Your assessment summary based on your findings and what you verbalize to the patient will also be captured and a plan. So the goal is obviously instead of you being done and I have to go now separately sit down with my laptop and write out my note and all these points and clicks, it will be you'll go back to your laptop and the note will be done for you, summarized. You're going to then accept it or you can edit it. Oh, I really meant to say this. Now you can make a couple of edits, you submit. So at the end of the day, you're really done with your notes rather than saying, okay, I have 10 notes to write. I have to go home and take time out of my day, or I had the opportunity to see another patient that was waiting to get in. Now I
Mhm.
have that time because I'm not bogged down with paperwork.
That's really good. So what do I just need to do? Like, I'm on the patient's chart already, right? So I just need to
Correct.
activate it. I have the mic already, maybe turn on the mic and then it will go with the flow. That's really the
Correct. So
easy.
when you open
Ah,
your
okay.
note,
Mm-mm.
there's gonna be a little icon, a little microphone you click on to start
Yeah.
recording. The system then tells you this is recording, and then you just start to talk, to your
Mm-mm.
therapist, to your patient. Let me know what's going on, and they tell you what happened. Then you, in your objective, you're gonna basically verbalize what the patient is doing, so the system can capture it. You'll
Oh.
say, it's a shoulder patient. I want you to raise overhead. That's 180 degrees of shoulder flexion, pain free at end range. You'll do your manual muscle testing and you'll say, okay, that's a 3+ out of 5 external rotation. The system captures that and puts that all in the note based on what you are saying,
Mm.
and what the response is from the patient. Same thing for tests and measures. You may say, well, we're going to do a Hawkins Kennedy. You perform it on the patient. That is a positive finding for Hawkins Kennedy, and it'll show up positive finding Hawkins Kennedy. So you're basically dictating what the
Yeah.
system is then going to put in there. And then
Mm-hmm.
I mean, that's one of the major pain points, not just in rehab, providers, PTOT speech, but in healthcare as a whole. Um, the large and extensive amount of documentation that has to take place and how much time that burdens providers down, which leads to burnout, which leads to frustration, which leads to lower productivity,
That's true.
which leads to revenue impact on a practice because you have therapists sitting there trying to do all these notes when we could leverage technology, artificial intelligence in this case, to
Mm-hmm.
do that for us.
That's really good. I remember this, what you're showing is like you're explaining more on the surgeon, like a doctor, and this is the
Correct.
another like assistant, and then they're talking to them like what they want to write, and then that's what she's doing. And then now what we're going to do is like we're talking to the patient, but because we need to dictate, all right, I have Mr. Smith here. She came here like walking with a walker with complaints of under subjective. We can put, and then we can edit it, something like that. So we just say what we want
Exactly.
to be inside. That's that I got the picture now. That's really interesting. Good. And I believe that will be an end product is I can see more and also the value that you're putting is time sensitive because once we document at the end of the day, that's true because it's not really accurate. Whatever you do at the end of the day, you forgot, and we just got what we. So this
That's
is
true.
how.
That's true. You're capturing a real-time conversation
Mm-hmm.
with data points that your memory may not. Oh, what did I say with Mrs.
Yeah.
Smith? Was it the left? Was it the right? Was it so you may have you may have to go back to notes and make sure you had the right information, whereas this will capture. And then the nice thing is it will give you a summary that will
Mm-hmm.
go to the note, but it would also provide you with the full transcription. So if you want to
Okay.
see line by line what your patient told you, you can go to the specifics and then say, oh, yes, this is exactly what they said or told me.
Yes, that's really good. And then sometimes I cannot apply it in where I work. I'm working in an inpatient rehab. We're doing it really like a typing. And then there's an
Hmm.
incident sometimes that I really write everything I want to say is so good, lots of meat, and then accidentally I delete it if something happened. I really hate myself then because I don't want to repeat everything I really
Yep.
said. It's shortened with less meat because I lost my momentum. And then here
Yeah.
it's there. That's nice.
Exactly.
Congratulations.
And you're not taking your eyes off the patient. Fully engaged because it's all capturing versus, we all as
Okay.
providers, you're talking to the patient, they're explaining, and as they're explaining, you start to type because you want to capture everything. It's not that you're being rude, but you're trying to
Mhm.
make sure that the data that you need for that clinical note is there. You don't have to do that now. You're fully engaged with the patient.
Okay. And that's how I look like when I'm in home health. We really need to be point of care, like typing, but we ask permission, like, okay, we're just writing this right now. And then
Hmm.
sometimes that's their comment. Oh, my therapist is always in their laptop. But as long
Yep.
they know,
Exactly.
they understand. So that's really good to know. How about the virtual care or like the virtual hybrid
Yeah. So
care?
that's another opportunity that we're very excited about that we've beta and launched several months ago in Q2 of this year.
Mhm.
And it's really a hybrid care, virtual offering where we actually expand the access of patients to clinics that really need to service maybe referrals that are in backlog or that are having staffing challenges, recruitment challenges. So we all know since COVID, a lot of the rehab and healthcare labor force left, and we're not replenishing those providers fast enough. This started out of necessity in one of our facilities that we had a physical therapy assistant but did not have a physical therapist. We were sending patients down the road to another facility, get evaluated, and you can come back. And we said, why don't we set up virtual evaluations? We then brought in virtual providers, started evaluating patients so they weren't waiting 2 or 3 weeks to get in, or we weren't sending them in conveniently down the road. We said, here's a virtual evaluation. We can evaluate you today, and then we can get you in to see that physical therapy assistant that's has a schedule available for you tomorrow. So it solved our access to care problem. It solved things related to patients that, hey, I can't get in. I have a commitment. I live too far away. I'm in a rural community. And it also solved the big issue, which is painting healthcare today, which is recruitment and not having enough providers. We're able to bring in remote providers to solve those two equations.
Mhm.
We have rolled that out within our owned and operated clinics here in Southern California. We have it now in five. We started in five of our facilities. We've started to broadcast and offer this to Optimis PT users across the country. We've already signed one contract with a practice that needs help, and we're speaking to several more. And
Okay.
then our vision is to then go beyond Optimus PT to other practices that may not be on our system but may have this issue, and we're working on solutions for that. One of the solutions that we're working on is the licensing of our clinical decision support. So the embedded practice patterns we have, we're setting up a light app version that can integrate with other EMRs. So if someone needed or wanted the solution, they would be able to use that and still follow evidence-based guidelines and treatment protocols.
That's really that's really good. So is this when I do an eval via virtual
Mhm.
care, is it the same like billing or you can still charge
Cor-
them differently, close?
Correct. Yes, yeah. So the billing would be the same. It would be a virtual, sometimes there's virtual codings that have to take
Yeah.
place.
Oh, they have.
Sometimes there's certain requisites on the payer side. So when you verify benefits, is there an allowable, for that type of treatment to take place or that type of evaluation? We're finding that most payers are paying, especially since COVID, virtual's become kind of mainstay, the telehealth, the synchronous one-on-one provider patient in a remote environment. So we are finding, yes, that payers are covering for this service and we're getting patients in faster. We're preventing complications due to delay of care, chronicity, complications, comorbidities developing because the patient is taking so long to get in. So we're getting them in faster.
Mm-hmm.
And then we're helping solve a big pain point for clinics that just say, I'm trying to hire, but I can't hire fast enough.
Yeah.
This solves that problem. It's solving growth needs for the practice. I just need more providers. I have them, but I don't have, I need extra. Or
Yes.
it's solving issues like PTO coverage. We all need to take time off. We all need to take a break, from care as clinicians. We carry a lot of challenge and burden and patients that are coming in pain and frustrated. So there are times you need to take away. But when you leave care, it's hard on the practice to say, well, now who's going to evaluate my patients or who's going to provide me that coverage. This is a solution that if someone does take time off, you can still have evaluations rolling through. So we're solving several things, and we're pretty excited about the results. And there's been a lot of interest and excitement about how this is solving groups right now within Optimus PT, but we're staging this and getting it ready to go really beyond Optimus PT to the whole industry.
Nice. Congrats. And then when you say eval, virtual care, but can we also do it in a regular treat, like a hybrid style? They can come in.
Correct.
Mr. Smith has some issues, so you can. All right.
Yes, yes. Right now we're it started as evaluations to
Mm-hmm.
feed in-person visits.
Yeah.
Where we're seeing this going is into a true hybrid environment where you will have virtual follow-ups, and we have started to do that as well. We're looking at things like, um, uh, and really as we move into value-based care and value-based propositions,
Yes.
where virtual, in-person, and virtual and true hybrid will be something that really drives those type of agreements and contracts where it might be based on level of medical complexity. If
Mm-hmm.
someone's a grade one ankle sprain, they may not need in person, then maybe they can be seen in home in a true virtual capacity. If someone needs in person something more complex, a shoulder adhesive capsulitis with daily manual intervention, that may be more in person. There may be a hybrid of the two where if someone starts in person, they may be able to step down to a virtual. They're not ready for full discharge, but they don't need to come in. They can be monitored. So it's kind of you flex it based on the patient's needs, which then drives more value, gets more outcomes in a desired timeline. And then over time starts drawing down costs, which is attractive to payers that are looking for opportunities where they can serve their patients, serve them quickly and optimally to get an outcome at a best overall cost of care.
That's really good. And then that's true when you just talk about that time sensitivity and also convenience for the patient. You combine it also with the employer from the setting itself, from the clinics itself, but also from the patient's point of view,
Correct.
right? That's good. That's good.
Yes.
Congrats. And then how
Yeah.
about when we say a licensing app? What is this all about? Like, do you have an app as well?
Yeah. So right now we're in the development phases of bringing the clinical decision support, those practice patterns that sit in our EMR today,
Uh-huh.
have a light version that has those practice patterns that can integrate with other EMRs. We're already in discussions with those third-party EMRs that are interested in the clinical evidence that sits in our system. That what one of the benefits that we see with that is as we look at hybrid care and as we look at the virtual offering that we've developed, um, if our clinical decision support sits in someone else's EMR, they can still access our algorithms and provide virtual care in an evidence-based context, but in someone else's EMR. So, if those that choose to come to Optimus PT, we will obviously, be more than happy to service those clients and train you and bring you on board with the full scope EMR that
Mhm.
has obviously the full functionality for all these things that we've just discussed. But there
Yes.
may be a group out there that says, either I'm happy with my EMR or it would be a very hard challenge to rip out the EMR. There's training, there's new implementations, so there's challenges. This would allow them to stay in their EMR if they chose to do so, but integrate our algorithms and evidence-based clinical decision support in that system, which then
Mm-hmm.
would allow them to treat some of these virtual patients, and especially as we look at value-based care, payer contracting, employer contract, you without that, it would be difficult for them to really be successful and have a standardization of care.
Yeah, so that's really interesting. So if they want to learn more about that, definitely they can just check on you guys. But what is
Yeah,
the
yeah, they can.
dilemma, Carlos? Let's say they have a contract, right? You say something about a contract, they have the current EMR. So how does the transition? Are you able to assist them in transitioning their previous clients? Is it very fluid flow of transition, things like that in the new EMR? If they're interested to
Correct.
learn more about it.
Yeah, if they would like to learn more about it, they can reach out to me. They can go to our website, optimuspt.com, and request a demo. There's a link right there, and then we would get you with our
Mhm.
teams to go through a whole demo, and we would present kind of what all these requisites look like, our scheduling software, the documentation,
Okay.
how the billing component factors into that. A lot of people have questions about that. In terms of
Mhm.
a transition, it's very easily done. Obviously, there's a data pull. Your current patients sit in your EMR, and there's a data request that then we migrate into our system to make that nice and easy and fluid.
Okay.
There's an onboarding and training process to bring your front desk, your schedulers, your billing personnel, your clinicians up to speed on how to use it.
Mhm.
Um, the system is very intuitive, very easy, but to say you're a proficient user, I'd say usually between 4 and 6 weeks is what that timeline looks like. And then the light app version would be for those that do not change, but still want this technology and this evidence-based sort of algorithm
Mhm.
to sit in their own system, whatever that might be. We're now working on integration. So it's like, hey, I want to do this. I want to move into this hybrid virtual offering and opportunity. I want to treat with evidence. We're
Mhm.
going to provide that for you in your system, and that's how that there would via an integration. It would be via an API integration, and then the systems would speak to each other. And as you're documenting, you'd be able to pull up that clinical decision support, and it would give you feedback that would then be able to sit in your system for those that do not switch over or feel like it's not the right opportunity or right moment at this time.
Okay, good to know. Yeah, at least there's a good support system. And then that whenever they have questions, because it's always technology is challenging. And then you can guide them. All right. That's really interesting. And thank you so much, Carlos. And in the question of, I know this is outpatient majority will be more on the setting, but any other setting that they can use the EMR, the Optimis PTMR.
Yeah, so we've had several, obviously PT, OT, and speech. We've had some
Mm-hmm.
chiropractic that's adopted our system. We've had some behavioral health specialists that have adopted our system. We have had some home providers. A lot of the home providers are doing, Medicare Part B in the home or outpatient
Yeah,
in
they
the
have.
home.
Mm-hmm.
So those are some. We have done some work with home health as well, but those are usually the main settings that will adopt our system. The Light app is really can be in any setting once, as we deploy that. Our goal is, again, we started, back with the APTA, developing these practice patterns. It does sit in our environment, but our goal is to take it beyond the confines of Optimus PT because we feel all practitioners should really have access to something like this because it's treating with the best level of practice or with what the latest research is saying are the standards of care.
Oh yeah, you just came from the private practice in the APTA convention. A little bit nuggets from the trip, what that you want to
Yeah, yeah,
share
great,
for
great,
all your
great convention.
colleague. Yeah. So what
Yeah,
did you
great
learn?
convention. It was I think the private practice section with the most attendance in history. So
Wow.
a lot of buzz and excitement, a lot of technology, a lot of artificial intelligence, being deployed, and it was great to see kind of the different vendors and colleagues out there and kind of what the latest adoptions are. But we were excited to be there and pioneering a lot of the things that we're doing, which we feel are very unique, and sit well to provide a lot of solutions for where the industry sits today and where the needs are.
That's good. Yeah, you're on the heads of that, right? Because the
Yes.
problem here, many clinicians are asking, these are all my problem, and then you provide solution, and you provide solution already on that documentation time, the burnout will be answered, staffing on the part of the employer, and also advance of care for that. time sensitivity for the patient itself, that somebody is able to get them ahead of time, that they're not worse, and especially after eval, they can give some a little bit home exercises. So congrats, that's really bridging the gap of everything. So congratulations again. So any closing remarks, Carlos, to our listeners, to all the clinicians out there and some patients itself?
Yes, yes, no, we appreciate your time. I mean, our goal is really at the end of the day is the end user. This is about the provider and the patient that they're serving, and if we can kind of solve those pain points in real time at the point of care, um, is really then we've been successful. But greatly appreciate your time and speaking to your listeners. And if anyone has questions, of course, they can reach out to me directly or the company, and we'd be happy to talk them through any questions or interests that they might have.
Yes, definitely. So guys, if you have any question and want to learn more about Optimis PT, I will going to share you Carla's email and then information and then their website. So that way you can personally connect with them. Just check that you watch it from Dr. Jenny in the video, Fishigen. So definitely it will be very helpful for them. If you cannot feel that they cannot answer your problems, or at least they can have it on again and provide some solution in the future, because everything will be upgrading, so you will be
Correct.
able to help them as a technology and some ways. So definitely connect with them. All right, so it's me again, Dr. Jenny Yusuf, physical therapist and doctor of physical therapy. We love to connect with you. If you have any questions, connect with us. This is another great innovations, and you will learn more about Carlos and the Optimus PT. We will have the Innovation Summit this coming December. So December 13 will be our Innovation Summit. You will be able to hear more about different technology in stroke rehab, Parkinson's disease, and different gadgets. And then we have EMR as well here with Optimus PT to learn you more a little bit deeper. All right. Thank you guys. Thank you so much, Carlos. God bless. All right.
Thank you.
Okay. Thank you guys. Have a good day.